Good morning, everybody. This is Nurse Eunice with Florida Training Academy. And in today's live review session, we will be covering handling medical emergencies. And I do apologize for the delay. Of course, anytime you are starting something new, such as adding these live streams to Zoom, of course, we're going to have technical issues. So I thank you for bearing with us, and we will get started shortly. And I think I saw that someone passed their CNA exam. So, congratulations on passing your test. All right, so let us begin. Question number one. A patient develops sudden severe abdominal pain after taking anticoagulants. What should be the next step? Is it A, provide pain relief medication? B, encourage the patient to walk? C, monitor for internal bleeding? Or D, give the patient food? And let's see if we have any correct responses so far. And we'll be revealing the answer in three, two, and yes, you are absolutely correct. The response is C, monitor for internal bleeding. Severe abdominal pain in a patient on anticoagulants or blood thinners could indicate internal bleeding, which requires immediate evaluation and of course intervention. Question number two, which of the following vital signs is most crucial to assess for a patient with a diagnosis of sleep apnea? Is it temperature, blood pressure, heart rate, or respiration rate? And for all of you all who are joining us today, Chrissy, Mila, some of the others, we were supposed to start at 9 a.m. Please make sure that you email me. I need your email addresses. I'm going to enter my email on the chat, which is admin@fltraining.com. And then that way I can send you direct invitations to appear as a guest so we can be live and do our reviews together. Of course, I would love to be able to hear your voices and just meet you since we're all together but separate in different areas. All right, so here we go. We're revealing the answer in three, two, and one. If you chose D, respiratory rate, you're absolutely correct. And here's the rationale. The respiratory rate is a vital sign. The respiratory rate is vital as it indicates the patient's ability to breathe, which is essential for sustaining life. Any compromise in breathing requires immediate attention. Question number three. During CPR, what is the recommended compression to breath ratio for adults? Is it A, 10 compressions to one breath, B, 15 compressions to two breaths, C, 30 compressions to two breaths, or D, 50 compressions to five breaths? And so, yes, this morning we've had a lot of technical issues. So I do apologize for those who are just joining in. But this is Nurse Eunice, and we're doing our live review. I would love to have you as my guest to join the review live. But I think the easiest way to do so is if you send me an email to admin@fltraining.com. And then that way I can send you a direct link as a guest so we can do reviews together. Revealing the answer in three, two, and one. If you chose C, that is correct. It is 30 compressions to two breaths. And so the American Heart Association recommends this compression to breath ratio for adults who are in cardiac arrest, and pretty much for any person, if you're a single rescuer acting by yourself, regardless of the age of the victim, it should be 30 compressions to two breaths. Great job so far in managing these medical emergencies. Question number four. If a patient is choking but is still able to cough forcefully, what action should the nursing assistant take? Is it A, perform the Heimlich maneuver, B, encourage the patient to continue coughing, C, administer back blows, or D, give abdominal thrust? The patient is still able to cough forcefully. What do you think the response is? Ashma says B, or Nuta says B. Let's see if we have any other responses. Miller Fam says B. Says say. I hope I pronounced that correctly. Flossie says B. Revealing the answer in 3, 2, and 1. And I hope I chose the right answer. I did. Ooh. All right. So B, encourage the patient to continue coughing. So if the patient can cough forcefully, it indicates that air is moving, and attempts to dislodge the obstruction should be supportive rather than obstructive. So once they are unable to cough is when you will perform the Heimlich maneuver. Question number 5, team. When assessing a patient's level of consciousness, which of the following is a correct response to verbal stimulation? Is it A, they open their eyes to bright light, B, they open their eyes to voice, C, they open their eyes to pain, or D, they do not open their eyes? Verbal stimulation. Ooh, Lord, with the answers on this one. All right, team. I see some correct answers coming through now. We have Ashma, we have Commendia. Hope I pronounced that correctly. Of course, we have our Chrissy, and we're revealing the answer now. And Mila. If you chose B, you are correct. They open their eyes to voice. So opening eyes to loud voice indicates a response to external stimuli and suggests a level of consciousness. Some of your patients, they may only open their eyes to painful stimuli. So that's when you'll see us in the facilities doing those sternal rubs. So monitoring your patient's level of consciousness is vital, because if there are changes in the level of consciousness, that means that your patient could be deteriorating or getting worse. All right, so let's see what our next question is. Question number 6. What is the appropriate position for a patient experiencing shock? Is it A, supine with legs elevated? B, lying flat on their stomach? C, sitting upright with legs dangling? Or D, in a semi-Fowler's position? I know this one's a little bit trickier. All right, so I see A's, I see D's, we're torn between A's and D's. All right, so this is what I want you to think about. When someone is in shock, that usually means that their blood pressure is low. So when someone's blood pressure is low, you would do A, supine with the legs elevated. So elevating the legs helps to improve blood flow to vital organs and can assist in managing shock. And we call this position the Trendelenburg position. All right, question number 17. Which of the following symptoms is characteristic of hypoglycemia? Is it increased thirst, warm, flushed skin, rapid, shallow breathing, or confusion and irritability? I see D's, I see A's. Let's see, I see more D's than A's. Let's see if we get 2 more responses and I'll reveal the answer. All right, team, we're revealing the answer in 3, 2, and 1. The correct response is going to be D, confusion and irritability. So confusion and irritability are common symptoms of hypoglycemia, indicating low blood sugar levels. So let's discuss A. A lot of you all chose A also. Increased thirst happens when someone has hyperglycemia, not hypoglycemia. So when the sugars are high, they may also be confused, but they'll usually be very thirsty. They'll be urinating a lot, and we consider that diabetic ketoacidosis. So if they're thirsty a lot, that's usually because the sugars are high, not because they're low. I hope that helps you understand. Mila says she's quite terrified of patients who are irritable. Mila, your nurses are going to be irritable. The doctors are going to be irritable. You're going to do fine. All right, question number 8. What is the first action for a patient who exhibits signs of hypothermia? such as shivering, confusion, and cold skin? Is it A, apply direct heat to the body with hot water? B, encourage the patient to move around? C, offer the patient a hot drink? Or D, remove wet clothing and cover with warm blankets? Looks like, oh, you all are awesome. Ashma, Jennifer, Yolanda, Magathia, Kanisha. Good morning, Kanisha. And then Sase. So everyone chose the correct response. Of course, it is D. You all continue praying for the victims of Hurricane Helene, the survivors who are up north, because they went from losing everything in a flood to now it is freezing there. And a lot of them are homeless. So the correct response is going to be D, remove wet clothing and cover with warm blankets. The rationale: wet clothing or cold clothing can worsen hypothermia, and covering the patient with blankets is the priority to gradually raise their body temperature. So we don't want to do anything extreme like put them in hot water. That could send their body into shock. Question number 9. Which of the following is a sign of a possible stroke? Is it A, nausea and vomiting, B, increased blood pressure, C, arm weakness, or D, rapid heartbeat? All right, what are you thinking, lifesavers? What are you thinking, team? All right, so Ashley, I'm going to pause to read this one. Let me find it. All right, so Nurse Eunice, I want to take a moment to say thank you very much. I've taken my state exam and passed both with an A plus. You are so welcome, Ashley. I'm so proud of you. And I know earlier someone else had indicated that they passed their exams also. So this is what I do. This is my passion, because I want to make sure there are enough healthcare workers who actually care and who are competent. So thank you for being a part of the Florida Training Academy family, and we welcome you as a colleague. You're no longer a student now. You officially have some initials behind your name. All right, so question number 9, everybody. The answer is C, arm weakness. So let's see what all we have here. We had a lot of C's and then we had a B. So arm weakness, along with facial drooping and slurred speech, are common symptoms of a stroke, indicating potential neurological impairment. So whenever you think someone's having a stroke, I want you to think fast. F, look at their face. It's probably asymmetrical. One part is drooping. A, ask them to raise their arms. One arm will not raise as high as the other. S, ask them to speak, and their speech is more than likely going to be garbled and hard to hear. And then T, time to call 911, or if you're in a hospital, you hit that panic button, that emergency button, and you get the nursing team in that room. So think fast whenever someone has stroke symptoms. Question 10. What is the appropriate response if a patient experiences a sudden loss of consciousness while walking to the bathroom? Is it A, place the patient in a seated position, B, elevate the legs above the head, C, lower the patient to the ground, or D, apply a cold compress to the forehead? How scary that would be for you and the patient. So what do you think the safest response would be? The patient loses consciousness while they are walking. Yes, you get a hold of that patient, see, and lower them to the ground. Lowering the patient to the ground helps to prevent injury due to falls and ensures an open airway for assessment and intervention. So you're going to gradually lower them while you are screaming help. Get help as soon as you can. Question number 11. A patient taking anticoagulants starts bleeding from a small cut. What is the most appropriate first step? Is it A, apply a tourniquet above the site? B, have the patient elevate the bleeding limb? C, give the patient aspirin? Or D, apply firm pressure to the wound? And we know it's not C. We don't want to give anybody who is actively bleeding an aspirin because, of course, an aspirin is going to thin the blood and cause them to bleed more. So we know it's not C. And for everybody who is saying D, you are correct. We're going to apply firm pressure to the wound. That is the first step to control bleeding, especially for patients on anticoagulants or blood thinners. Tourniquets are only used in severe cases of uncontrolled bleeding. Question number 12. What is the primary goal of cardiopulmonary resuscitation or CPR? Is it A, to restore normal heart rate, B, to improve oxygen saturation, C, to maintain blood pressure, or D, sustain blood circulation and oxygenation? So when we have you giving those 30 compressions, followed by those 2 breaths, and we're trying to save that person's life, what are you doing? Are you restoring the heart rate, improving their oxygen, maintaining their blood pressure? And everybody has the right answer. You're sustaining blood circulation and oxygenation. So CPR aims to maintain circulation. That means that you are externally being that person's heart. You are compressing. You are circulating blood throughout their body to their vital organs. And what is carried in the blood? Oxygen. So we're trying to prevent brain death. And then the AED, when we use that device, that is what shocks the heart and hopefully restores a normal rhythm. Okay, so in addition to CPR, compressions and breaths, we also need the AED to help save someone's life. Question 13. Which of the following is a common symptom of an allergic reaction? Is it hypothermia, bradycardia, itching and hives, or hypertension? And a symptom is something like you can see or something the patient reports. So what is something you can see or that you can hear? All right, this one was super easy for you all. I didn't expect any of you to get this wrong. So yes, it is C. Itching and hives are common manifestations of allergic reaction and often due to release of histamine. Question 14. A patient with diabetes becomes pale and clammy and feels weak. What is the priority intervention? Do we want to A, administer oxygen, B, give the patient a source of sugar such as juice, C, monitor vital signs, or D, lay the patient flat? I see a lot of C's for this one. I see a B. I see more B's, so we are torn. So for this one, the patient became pale and clammy, not because of low blood pressure. So even though monitoring vital signs might be important, because we know this patient has a history of diabetes, the priority is going to be B. Give the patient a source of sugar, such as juice. And that is because it's going to quickly raise the blood sugar level by providing fast-acting carbohydrates to address the hypoglycemia. And then after you give them juice, make sure you follow it with a tray of food, something that has protein. Because if you don't feed them after raising their blood sugars with the juice, the sugar is going to crash. It's just going to drop again. But protein helps to sustain those sugar levels. And of course, you would be doing all of this under the direction of a nurse, but at least you would understand what to do in the event that a patient becomes pale and starts to sweat due to low blood sugar levels. Question 15. What is the purpose of the recovery position? Is it A, to maintain an open airway, B, to prevent hypothermia, C, to reduce blood pressure, or D, to improve circulation to the extremities? Why place a person in the recovery position? I'm so proud of you all. If you all could see my facial expression, I'm not on camera today. I look like it's the weekend. I got on a Rugrats t-shirt. So let's see. We have a lot of A's and some B's, and the correct response is going to be, let me switch slides. A, to maintain an open airway. So the recovery position helps to prevent airway obstruction by keeping the airway clear and allowing fluids to drain. Now, you may not see us doing the recovery position a lot in a hospital, and that is because the heads of our beds elevate, we have suction equipment. But if you're outside of a facility that has medical beds, let's say you're in home care, or if someone is having a medical condition outside of a hospital setting, don't forget that the recovery position helps to maintain that open airway. And in case they vomit, it's going to hopefully allow most of that vomitus to escape their mouth so they don't aspirate. Question 16. Which of the following is a symptom of diabetic ketoacidosis, also called DKA? Is it A, hypoglycemia, B, fruity breath odor, C, bradypnea, or then D, low blood pressure? Which would be the correct response? All right, and for this one, I see a lot of correct responses. We're going to be revealing the answer in three, two, and yes, it is the fruity breath odor. So hold on. Let's go. We got another person who said they passed their test. Let me go back. I'm over here doing my nurse dance, Fabian. So, hi, beautiful miss. I came to say thank you. I passed my state board yesterday. Thank you so much for your videos. I am so proud of you and congratulations. All right. You all make my heart smile. So, again, can a seizure cause someone to vomit? It doesn't necessarily cause them to vomit, but what happens is afterwards, because of just like all this, how should I say it? Muscle twitching, the convulsions. Remember, your stomach's also a muscle. So it's also impacted when someone seizes, their extremities are moving, etc. So think of what's happening internally. So, yes, the convulsions, the muscles constricting can cause someone to vomit after a seizure or during a seizure. Great question, Mila. Question 17. What should a nursing assistant do if a patient exhibits signs of respiratory distress? Is it A, administer oxygen immediately? B, encourage the patient to lie flat on their back? C, offer a glass of water to drink? Or D, place the patient in a high Fowler's position? And then once I give you the answer to this one, I want to remind you that next week, when I say we're going live on Zoom, we're going live on Zoom. I need you all to be there with me. All right, so the response to this one is D, place the patient in a high Fowler's position. So the high Fowler position is also used for individuals with breathing difficulty as it pulls down the diaphragm and relaxes the abdominal respiratory muscles, allowing maximum chest expansion and improvement. So like this person here, it's the illustration of somebody who's having respiratory difficulties, but she is reclining. No, we're going to sit her up. And if she's unable to sit up, we're going to put pillows behind her back so that in case she doesn't have like the core muscle strength to help sit her up. So the patient should be upright 90 degrees if they are having respiratory concerns. 18, what is the recommended action for managing a nosebleed? Oh, we took you all around the world with this test. So is it A, apply pressure to the nostrils and tilt the head back? B, apply pressure to the nostrils and lean forward? C, insert cotton swabs into the nostrils? Or D, administer nasal spray? All right, and I'm entering my email address again in the chat, which is admin@fltraining.com. If you want to appear live as one of our guests, I need some co-hosts. It's lonely over here just talking to a screen. I want to actually talk to people. So if you want to join as a co-host, I need you to email me and make sure that you're available with your cameras on, and you can be live in one of our upcoming videos. All right, so everybody, for 18, it is B. Yes, so it is not A. A was old school. They'd have you apply pressure to your nostrils and then tilt your head back, which forced you to swallow blood. When you do it the correct way, you squeeze the nostrils and lean your head forward, you can spit the blood out of your mouth. So you're not going to be swallowing any blood. So this helps to control bleeding, but also prevents you from swallowing things that you don't want to be swallowing. Question 19, a patient on anticoagulants falls and hits their head. They do not show immediate signs of injury. What is the next best action? Is it A, tell the patient to rest, B, apply an ice pack and monitor, C, call for immediate medical evaluation, D, wait to see if symptoms develop? Yeah, Mila, our grandmothers had us do all types of stuff that, according to current standards, we shouldn't be doing. And we survived, but you don't want your patient to be tilting their head back. They're already squeezing their nostrils. So with their head tilted back, they're trying to breathe, swallow blood, control bleeding. It's just too much. So squeeze the nostrils and lean forward. All right, so we're revealing the answer in 3, 2, and everyone has it correct. It is C, call for immediate medical evaluation because patients on anticoagulants are at a higher risk for internal bleeding, particularly after head trauma, even if no symptoms are immediately visible. Question 20, what is the appropriate action if a patient is experiencing a minor allergic reaction without difficulty breathing? Is it A, offer a glass of water, B, administer antihistamines, C, use an epinephrine autoinjector, example, an EpiPen, or D, notify the nurse? I see a lot of correct responses. See if we have some more. Yes, yes, yes. Tamika, Chrissy, Jean, Chrissy, Christopher. It's a lot of you all. Barack Services Limited, you all are correct. If it's minor, we're just going to simply do D. We're going to notify the nurse. The reason that you want to tell the nurse is because the nurse may not even know that this person has an allergy to something, whether it's a medication or a food. So you want to notify the nurse so she can go in and evaluate because allergic reactions can worsen and become life-threatening. So notifying the nurse will allow us to, of course, do additional assessments and provide additional treatments if needed. Question 21, what is the primary purpose of the Glasgow Coma Scale or GCS? Is it to monitor for motor function, measure blood pressure, evaluate the level of consciousness, or determine the oxygen saturation? Glasgow Coma Scale. What do you think? And I think I mispronounced it as Glasgow. Revealing the answer in 3, 2, and yes, we're going to be doing C. We're evaluating the consciousness of the patient. We're doing their level of consciousness. So the Glasgow Coma Scale is used to assess and quantify the level of consciousness in patients with brain injury or altered mental status. So we'll be doing this a lot with patients who are post-op because of the sedation that we're giving them, a patient who may have had a stroke, or after any type of cranial or brain surgery. Question 22, which of the following actions should be taken if a patient is having a seizure? Do you want to A, restrain the patient's movements, B, insert a padded tongue depressor into the mouth, C, move nearby objects away to prevent injury, or D, administer oral medication? Looks like Chrissy, Isato, Miller family, Tamika, Chrissy B. Yes, everybody is saying it is C. You want to move those nearby objects out of the way. So while they are seizing, you try to remember the time that the seizure started. Of course, you hit that panic button or you put 911 on your phone and then place that phone on speakerphone. Start moving those objects out the way. And so as long as they don't injure themselves, usually a seizure is going to be self-limited, especially if it's a short seizure. Once the seizure has ended, that's that's when you can, put them in a recovery position, place them on their side in case they vomit. Question 23. In a patient who is experiencing shock, which sign would you expect to find? Is it A, high blood pressure, B, cool, clammy skin, C, warm, dry skin, or D, rapid and shallow breathing? And this one should be easy for you. A patient who's experiencing shock. I see C's. I see B's. And we'll reveal the answer after we get 5 more responses. So we're torn between C's and B's, and now I have an A. So I'm going to reveal the answer in 3, 2, and it's B. Remember, usually when they have shock, their blood pressure drops. Their heart rate increases. So shock typically presents with cool, clammy skin, low blood pressure, and rapid, shallow breathing due to inadequate blood flow and oxygenation. Question 24. Which of the following is a symptom of heat stroke? Is it A, shivering, B, cool, clammy skin, C, rapid pulse, or D, pale complexion? And I hope you're learning a lot. I know some of these illnesses or conditions you may not have to worry about depending on where you are located. Like in Florida, we don't have a lot of instances of hypothermia. But if you're up north, you may not have a lot of instances of heat stroke. But what do you do if someone has a heat stroke? When they have a heat stroke, they're so hot until they stop sweating. They're unresponsive, but they're still breathing. And if you check their pulse, it would be C. They have a rapid, weak pulse. So a rapid pulse is a common symptom of heat stroke, reflecting the body's attempt to cool down. And so heat exhaustion is what happens when that construction worker is outside working in the Florida heat. He's still able to communicate with you. He can take sips of cool or room temperature water. He'll be fine. He'll go home and rest. So heat exhaustion versus heat stroke. Heat exhaustion, they may feel faint or dizzy. They are still sweating. Their skin will be cool, pale, and clammy. They might become nauseated, which is why we don't give them a whole bunch of fluids. We give them small sips of fluid. They're going to have that rapid, weak pulse. And then they also, because they're dehydrated most times also, may start having muscle cramps from the lack of electrolytes. So we can give them Gatorade or some type of electrolyte beverage. And now when you go over to heat stroke, usually they're not responding to you. So, but once they are able to communicate, they have a throbbing headache. Remember, they're not sweating. The body temperature is above 103 degrees. Still the same symptoms with nausea and vomiting. And I do apologize. I said a rapid weak pulse, but this says a rapid strong pulse, and they may lose consciousness. When someone's at risk of heat stroke and they are unconscious, we do not give them any liquids. This is a medical emergency. You are calling 911 so that they can cool this person off internally, usually with intravenous fluids, and or externally with a cooling blanket. Question 25. A person collapses and is found unresponsive but breathing. What should be your immediate action? Is it A, begin chest compressions, B, roll the person onto their side, C, leave them to go get help, or D, give them rescue breaths? Unresponsive but breathing. Oh, you all are slower with responses for this one. I see B's. I see a lot of B's. I am so proud of you. Yes, that would be the recovery position. So rolling the person onto their side in the recovery position helps to keep the airway open and prevents aspiration in an unconscious person who is still breathing. Do not leave them. If you do have to leave them, make sure, let's say your phone's in a different room or something, let's make sure they're in the recovery position. That way they won't vomit and be on their back when they vomit. So go get the phone, go unlock the door for the emergency personnel, but then get right back to their side in case they go into cardiac arrest. Question 26. What should a nursing assistant do if a patient is experiencing a panic attack? Is it A, encourage deep breathing exercises, B, administer a sedative medication, C, restrict movement to prevent injury, or D, offer a caffeinated beverage? Someone is hyperventilating. They're experiencing a panic attack. What do you want to have them do? If you chose A, you are correct. You want to encourage them to take deep breaths in. You can also use imagery. Tell them to imagine they're somewhere happy and peaceful. But deep breathing exercises can help alleviate symptoms of panic attacks by promoting relaxation and reducing hyperventilation. Question 27. Which of the following is a sign of internal bleeding? Is it pallor or pale skin, B, warm, flushed skin, C, abdominal distension, or D, decreased heart rate? Signs of internal bleeding. And you know what? For everybody who's choosing A, you're not wrong, but give me another answer. Now I have a whole bunch of B's. All right, so I'm going to reveal the answer in 3, 2, and so what usually happens first with internal bleeding is that because blood is seeping out of an artery or an organ, before they turn really pale, you might start to see distension in the abdominal area. So abdominal distension can indicate internal bleeding as blood accumulates within the abdominal cavity, causing swelling. And now secondary, due to the low blood pressure, that's when they become pale. So I hope that helped you understand signs of internal bleeding. Question 28. You are a certified CPR and first aid provider. What is the appropriate response if a patient is experiencing a drug overdose? Is it A, wait until the person goes into cardiac arrest and then start CPR? B, encourage the patient to drink fluids? C, administer naloxone or Narcan for an opioid overdose? Or D, apply ice packs to the forehead? And I see a lot of correct answers. So, if you are certified in CPR and first aid, you know that they have intranasal Narcan. So, the answer would be C. You don't want to wait. Of course, you're going to call 911, but if you suspect someone has a history of drug abuse and that they have overdosed, as long as they are still breathing, you try to stimulate them, you do the sternal rubs. As long as they are still breathing, you can give them intranasal Narcan. And this is available to the public. So you don't have to be a nurse, a doctor, or a pharmacist to give this medication. In the hospitals, we don't give Narcan intranasally. Your nurse would start an IV, and we would give Narcan via intravenously via IV push. So that's why you don't see these devices in your hospital systems. So naloxone or Narcan is an opioid antagonist used to reverse the effects of opioid overdose and restore normal breathing. Remember, if you have to give someone Narcan, you need to be calling 911 because they may need a second dose of Narcan. Plus, when they wake up, they don't wake up too happy. So you're going to have to communicate with them and try to calm them down because you just bound up all of their drugs in their body. So sometimes they can wake up very confused and somewhat combative. Question 29. Oh, guess what, everybody? If you stayed this long, you know I need help with the algorithm. Go ahead and give this video a thumbs up. I don't see any thumbs up. Give us some hearts. And don't forget to like, share, and subscribe. So let's continue. Question 29. What action would you expect the nurse to take if a patient's oxygen saturation level falls before normal? Is it A, administer supplemental oxygen, B, encourage the patient to cough forcefully, C, check blood glucose levels, or D, elevate the patient's legs? And we have 35 questions plus a bonus question. So I thank you all for staying with us and studying with us today. I appreciate you all so much. And I know that if you're not currently a healthcare professional, that you're going to make an awesome medical professional because of the way that you're studying and how serious you are about taking care of others. So for question 29, the correct response would be A. So let's go back. If the person's oxygen saturation levels fall below normal, you would expect that that nurse will be putting on oxygen. So administering oxygen helps to improve oxygen saturation levels and helps to alleviate hypoxemia or low oxygen levels within the blood. Question 30. After cooling a minor, I apologize for the typo, a minor burn with water, what is the next recommended action for managing a minor burn injury? Is it A, apply ice directly to the burn, B, cover the burn with a dry, sterile dressing, C, rub butter or oil on the burn, or D, pierce any blisters that form? So we have a minor burn that you have cooled with running cool water. What do you do afterwards? Yes, Lauren, Chanel, Chrissy, Jessica. Yes, Asata. If you said B, cover it with a dry, sterile dressing, you understand that that helps to keep the area protected from infection and promotes healing. So always cool the burn first and then put a protective gauze over it. Question 31. Which of the following is a symptom of anaphylaxis? Is it bradycardia, hypotension, swelling of the face and throat, or D, slow, shallow breathing? Anaphylaxis. All right, let's see what the answer is. I see so many correct answers in the comment area. So if you chose C, you are fully aware that anaphylaxis is a severe allergic reaction that can start to close that person's airway. And so C is the correct response. Swelling of the face and throat are both hallmark symptoms of anaphylaxis, indicating a severe allergic reaction. Question 32. A patient begins to experience shortness of breath and wheezing shortly after eating. What should be your first action? Is it A, lay the patient down, B, administer oxygen, C, check for food allergies or aspiration, D, give the patient water to drink? What are you thinking? Whether you're a nurse or a CNA, what would be your thought? You could be a nursing student and this person starts to experience shortness of breath and wheezing, and you call for help. But while you're waiting for help to come, I need for you to be thinking about, yes, Chrissy, love, Khalees, yes, see. If they didn't have any symptoms until they started eating, there's a good chance that it could be due to a food allergy or that they aspirated. So wheezing and shortness of breath after eating could indicate an allergic reaction or food aspiration. Assessing the cause is important in determining the next steps in treatment. And here's an image of some of the common common items, food items that people are allergic to. So of course we have strawberries, we have citrus there, we also have nuts, we have fish or shellfish. And so those are some common allergies. If a person starts wheezing, you want to be kind of thinking of the cause. And if you're a CNA, whenever that nurse gets in the room, I'm sure she's going to be asking, hey, what did they eat? Because if they had an allergy to something and we were not aware, we'll have to change their diet order. Question 33, you're working in home care. What should you do if a patient experiences sudden chest pain that radiates to the left jaw and arm? Is it A, apply a cold compress to the chest, B, administer Tylenol, C, encourage the patient to rest, or deactivate emergency medical services, aka if you're in the US, that is 911. It's a different number depending on where you are located within the world. So not every country has 911. Some other countries have different phone numbers. So we're going to be revealing the response in 3, 2, and yes, it is D. You have to activate emergency medical services because sudden chest pain with radiation to the left arm and jaw can be indicative of a heart attack requiring immediate medical attention. I want you to remember that women do not have the classic doom and gloom symptoms that a man has when they are having a heart attack. A woman might be having back pain while being tired. And I know that is so generic because we're doing so much. We're kind of always a little tired, low on energy. But if this person also has diabetes, high blood pressure, I would recommend that they go to the doctor, especially if they're complaining of severe back pain. Go to the doctor, get an EKG, call 911, get an EKG, because that could be indicative of a heart attack in a woman. So usually we don't have chest pain, jaw pain, etc. Question 34. Which of the following is a sign of a worsening head injury? Is it A, bradypnea? Is it B, widening pulse pressure? Is it C, constricted pupils? Or is it D, decreased level of consciousness? A worsening head injury. Yes, love. Yes, blessing. Jessica, Chanel, D, and you all are correct. It is D, decreased level of consciousness. We know that that is a common sign of increased intracranial pressure, reflecting neurological impairment. So that's why we monitor those patients after they have head injuries, because the swelling within the brain could worsen and they may become unresponsive. Question 35. This is easy. What is the primary goal of wound care? Is it to minimize pain, prevent infection, promote healing, or reduce scarring? What do you think, team? And I'm so proud of you all. I hope you're proud of yourself. So many of you all got these answers correct. So if you are preparing for your CNA exam, I hope that you feel encouraged. Don't forget that at our website, fltraining.com, we have a whole bunch of free resources. You will go over to the resource tab, and then it's going to say like free study guides and more. That's where you would go and click to access our free resources. I need some thumbs ups and some likes on this video, and I'm revealing the answer in 3, 2, and yes, you all, we have to prevent infection. So the correct response is going to be B. So with wound care, let me go back. Promoting healing, yes, that's important. Minimizing pain is important. But if we don't prevent infection, it will not heal and there will be increased pain. So the correct response is B. The primary goal of wound care is to prevent infection, as infections can delay healing and lead to further complications. So let's talk about cellulitis. Let's say someone had a skin infection on their toe. If it's not treated, that infection is going to get to the bone. If we cannot cure it once it is in the bone, that's when they start having amputations. So preventing infection prevents all of the other symptoms that were mentioned on the previous slide. All right, and here's our bonus question, team. Which of the following is a sign of an opioid overdose? Is it bradycardia, dilated pupils, pinpoint pupils, or hyperactivity? This one's hard. I'll give you 15 seconds. 10, 5. I'm revealing the answer now. It was C, pinpoint pupils. So yes, pinpoint pupils are a classic sign of an opioid overdose due to central nervous system depression caused by opioids. So if you look at the one image of the normal pupil, so when we say dilated, it would be that area that's blue would have a larger black pupil. So dilated means that it's more open. Constricted or pinpoint, if you look at like the tip of a pen, that's how their pupils would be. And that is a classic sign of an opioid overdose, everybody. And so you all know how much I appreciate you and I adore you. I will, of course, stay around to answer whatever additional questions you have. I'm thinking on Monday, I'm going to be doing a live on breast cancer since this is Breast Cancer Awareness Month. And so if you haven't already done so, please like the video. Thank you for commenting and entering your answers. You can also share our channel and also this video with others. And let's see what questions we have in the chat. You're so welcome, Chrissy. And happy Saturday, everybody. I hope you're going to do something fun today. Let's see. Are there any questions for me? I'll give you about another minute before I exit this live stream. And don't forget, if you want to join us live and actually appear on camera, I need you to email me, and you're going to email me at admin@fltraining.com and just say you want to be on the next live. I will add you as a guest, and you can appear live, and you can help me answer the questions, ask the questions, and just make it more engaging. So I'm not always over here just talking to a screen and not hearing your voices. So Lauren, I come on pretty much, it's random, and I do apologize, but we do put notifications in our community section on our YouTube channel and also on our Facebook page. There's usually a notification. So if you're not getting those notifications, make sure that you are not only subscribed, but that you turn your notifications on so that you'll be alerted. And you all are so welcome. Love, you're so welcome. And thank you all who send us some support through either Cash App or someone sent I think it, and I do apologize. I think it was Buck. So Buck, whenever you watch this video, thank you for sending the monies for the coffee. I do appreciate you for your support. And next week I'll work on channel memberships. And that way, those who are actually part of our channel membership, which will only be about $2.99 per month, they would be able to not only get their questions answered first, but they would also be privy to additional live streams where they can participate in first before we actually post that to the general audience. So you all, let's see if I have any other questions here. You're so welcome, Lauren. Please add me when you're live. So, and I don't want to mispronounce your name. I am going to go ahead and enter my email address. So make sure that you email me so that way I can add you as a guest. And then the Miller fam, the Miller fam, you're like my fam. You've been here for like 2 months now. I hope that you pass. Also, I know that you're going to do well. So everybody, I love you all. What do I need? I just need for you to email me. Once you email me, I will have your email address and I will send you a link where you can appear as a guest on our live stream. So it's really easy. You email me and that way I will have your email address. All right, everybody, happy Saturday. I'm going to see you all on Monday. I don't know what time, but it's going to be on breast cancer awareness, and we'll be talking specifically or answering questions about different types of cancer and or breast cancer in both men and women. Remember that men also are diagnosed with breast cancer too. So I love you all. Have a good day and bye.